Good evening, ladies and gentlemen, and good evening to those that are here with us in Geneva and to those that are following us from home. I am Paola Barbarino, the CEO of Alzheimer's Disease International, and I am joined today for the launch of our 6th edition of Plan to Impact report, although it is action that we are looking forward to, by a roster of very important panelists. We are going to have with us Birgitta Martensson, the former CEO of Alzheimer Switzerland, a board member of ADI, and currently living with Alzheimer's disease. Dévora Kestel, the director of the Department of Mental Health and Substance Use at the WHO in Switzerland. Mr. Alex Gobey, the director of Dementia Care within the Ministry of Active Aging in Malta. Dr. Saidatul Norbaya, good evening. Thank you for coming. You've been running from the assembly. Thank you so much. The Deputy Director of Family Health Division in the Ministry of Health in Malaysia. Mrs. Astrid Dunselman, the Health Attache here in Geneva for the Ministry of Health Holland. And we are going to have Kristine Galstyan, who is the chief organizer of the Public Health Department of Armenia. She's going to join us online. That's going to be technically challenging. And then, last but not least, we're going to have Thomas Cueni, the Director General of the IFPMA. And I know a lot of you will be interested to understand what's happening in the therapeutic area as well. So, as ever with all of the ADI panels, this is going to be fast and furious. And I am going to start with the presentation of our wonderful report, the Plan to Impact version 6. Now, many of you know that since the Global Dementia Action Plan of the WHO was approved in 2017, year on year, we've been monitoring what governments have been doing about it. And we've been doing that from the point of view of grassroots organizations. So we wanted to know what people on the ground, people living with dementia and carer were feeling, were changes, improvement that were happening to their health. And this was supposed to work and is working hand in hand with the GDO, the Global Dementia Observatory, which is the WHO's own mechanism for monitoring government action. So next slide, please. I have already introduced myself, so next slide, please. ADI, as some of you know, we are an organization that was established in 1984. We represent 105 organizations at national level. Tonight with us are, in particular, Alzheimer France, represented by Laurent Gilly, and Nezabutny, Ukraine, represented by Irina Shevchenko. And every year we sort of ask some of our members to come with us here at the Assembly. It's a great honor to have you with us. We represent all of you at the WHO, at the UN, at the OECD. 2 weeks ago, I was at the G7, G20, and so on and so forth, all of these mechanisms. But also we do a lot of work nationally. We publish the World Alzheimer report, and we, of course, promote World Alzheimer's Month. So many of you do every year, so thank you very much. I wouldn't be here today, incidentally, if it wasn't for the fantastic work of my team. And I want to mention here Chris Lynch and Louis Arthurton and Jane Ciborra that are with me here in Geneva, but also Wendy Weidner, Chloe Benoit, and Taylor Patalo, who have been extremely active together with Laura Aubert in particularly the What's Your Plan campaign, which I'm going to speak to you in a second. Next slide, please. This is just to remind you very quickly that we are a charity, so any donations will be appreciated. The next slide, please. And this is the report. Now, many of you will be asking online how you can access it, as all of our report is available online freely at our website. So this is where you can find the report. There are also copies of the report in the room, so everybody here can bring back their own printed copy. Next slide, please. Now, this year, we've been doing a huge amount of work with our What's Your Plan campaign. So although the report contains a lot of not very data around what's actually happening in the world, we are not seeing great progress in the Global Dementia Action Plan. It has to be said, though, that we have been doing a lot of work with a campaign in which we've been trying to put pressures on government from the point of view of people. So This is something we've not done before. Usually our work is behind the scene. We try and work with government to persuade them to do things. But where this has not worked, we've now gone public with the public campaigns on media, social media, etc. The first one we launched was in the Caribbean, and it's been extremely successful. So now we're talking with 5 governments that before weren't thinking of doing anything in this area. So it's working, and we will continue to do it. The next one will be with the European country. Now, next slide, please. So this is the current state of the national dementia plans. Although you can see the north of the world is very red, you can, however, see that there is a lot of places in the world where there is absolutely nothing. And we are very hopeful of some countries that are starting to develop their plan. Tonight, we have a representative of Malaysia, and we are so hopeful that Malaysia will be the next country to announce a plan. We've been working in Africa now for years in the hope that we will have a first plan, but yet, unfortunately, has not materialized. In South America this year, we got the second major plan approved. So it's something that is happening. And this kind of data is heartening, but the targets of the Global Dementia Action Plan have not been met. And we would need in the next 2 years, 100 countries to join the countries that already have a plan, which is about 30, in order to meet this target. So this is not going to happen. So together with the WHO and Dévora Kestel will talk to us about this. Dévora, what are you doing? You should be sitting there. Oh, that's fair enough. So together with the WHO, we are strategizing what to do about the plan, because we think that if we have a lot of momentum, if we increase the amount of space or time that we have for the plan, that is going to make a difference. But the other thing we're doing, we are looking at it very pragmatically. We think strongly, this is why we were speaking at the G7 last week, that the G7 countries should be leading the way and should be doing everything that the plan says they should be doing. Because the plan actually is a brilliant plan. It's not a bad plan at all. It's just that it's complex to achieve. But for smaller countries, for countries that don't have so many resources, it's very important that we are pragmatic. Let's not perfect be the enemy of good. It could be the strapline of the report. We should start from somewhere. It may be a risk reduction campaign. It may be some activity to relieve carer from their caring duties. It has to start from somewhere. And so we are trying to go to government with practical interventions that they can do in the complete understanding that the whole plan is perfection, is where we would want to be if the world was a perfect place. But the world is not a perfect place, and we need to start from some activities. Next slide, please. This also shows you in a more practical way how many plans have been adopted, 39, that's in gray, and how many are in development, 22, that's in deeper red, 133 is how many we need. So we're not going to get there. Next slide, please. So these are the key recommendations of the plan. We won't have time to discuss them now because otherwise I'll take all the time. I'll leave you to read them in the report, but the most important thing is that we are calling for an extension of the plan, and critically to tonight, we are calling for health system to be strengthened generally, because there are things that are happening. There are therapeutics on the horizon. The World Alzheimer report 2 years ago was on diagnosis. Last year, it was on post-diagnostic support. This is coming. People are asking for change, and Birgitta will tell us more. So this is going to happen. Everybody's got to be better prepared. And with that, I'm going to close on the presentation of the report, and I'm going to ask my panelists to join me for a panel discussion. And the first person I'm going to call on is Birgitta Martensson, former CEO of Alzheimer Switzerland and former board member of ADI and currently living with Alzheimer's disease. Birgitta.
Oh, yes, it does work. Hello, everybody. It's very nice to be here again and to be invited to speak. Quite a difference to be invited as a person with dementia, but that's perhaps the most important role I've ever had. So my case, my mother had dementia. She died of it in 2015. My sister also has dementia. She's 2.5 years older than I, and I have dementia. And it took time to really get a diagnosis because I have a very high cerebral function. So all the tests were, no, it doesn't say that you have dementia. So the final test that was made was a lumbar puncture. Puncture, thank you. And that finally proved that, yes, I have a pure Alzheimer, which is interesting enough for research. And it was good for me to get the knowledge because I knew much longer before the specialists around me because I was really well surrounded by professors and so on. So I think there is a lot to do in the field of the way you examine people with where you have the feeling that someone has dementia. I think there's a lot to develop in that field to have smarter, quicker ways of getting a diagnosis, a sure diagnosis. Perhaps before going to a lumbar puncture, because most people are rather afraid of it, but it doesn't hurt actually. So today I take two medicines. I take the donepezil, if you say it like that in English, and memantine. You're not supposed to take both of them, but I do because I know the professor who is leading the memantine team. So that's why I take both of them. And I don't know if it's good or bad, but I quite support it. So life with dementia is going on like I always did. It takes more time. I need more time to find my way, not to find my words. It's fairly okay, but orientation and planning and things like that. And I live on my own without any kind of support. So it's a good life. It doesn't hurt. I think we should really make people know that it doesn't hurt. And you can plan your own life and do things that you want to do now, not wait until, I should have loved to do that. So to wait for a diagnosis is absolutely not a good idea. You're not happy living with you know that you have a problem. Don't say, if people say to me, I don't know if I have the problem. Okay. But most of the people know that they have the memory problem. So I would only suggest go and have an examination. And tomorrow there will probably be better ways of knowing if you have dementia or not, because there are promising researches also in the field of how to diagnose, and also the treatments. And finally, there is a treatment who's attacking another field than the actual treatments that we have is aiming. So I think we're in a very promising time. And I just hope that most countries, that all countries in the world where there is an Alzheimer Association or similar, that they will be members of Alzheimer Disease International, because we need to prove our strength on the international field, not just wait and see. So please, if ever you are from a country where you don't have an association or where your association is perhaps no longer active, try to be active, talking to the people and try to get the movement going in your country, because we need the help that we can get where we live. I don't want to have to go to England to get I want to get my help in Switzerland. So I think that's one of the most important things. What more did I say? Oh, I can't read anymore. Yeah, and yes, I know what I want to say. So I will close with this remark that I think we really need to include people with dementia in all the stages and to really hear what they are saying. We have been very open to receive the carers of people with dementia. I know it because I was 15 years at the head of the Swiss Alzheimer Association. But we, the people living with dementia, I think we know better. And you really must aim to include people with dementia much, much more in an active way, not just have them sitting there in the room, but in a very active way, like I am doing now, taking too much time. Is it so? So thank you for listening.
Birgitta, thank you so much. And you're right, it's so important to have this testimony up front. It kind of gives a completely different feeling to the area. Now, I just want to thank those that are still joining online. We have over 50 countries, I think, online. So thank you very much. I don't know how many more we got on the floor. I also can remind you, if you want to ask a question, please put your question in the Q&A. You can use the chat to talk to each other or to tell us who you are, but use the Q&A on Zoom. And now I'm going to hand the floor to Dr. Dévora Kestel, who is the Director of the Department of Mental Health and Substance Use at the WHO. Dévora.
Thank you, Paola, and thank you all for being here today and for joining together to push for this agenda to become a reality. I'm speaking today on behalf of Professor Jérôme Salomon, who is the Assistant Director General of the WHO Universal Health Coverage, Communicable and Non-Communicable Diseases, a very long name, who couldn't make it today. To in a way, celebrate, if one could say, the release of the report, the launch of the report that Paola just presented to us. And also in this year, this coincidence with the second progress report that we are presenting at the World Health Assembly, that we don't know, for those of you following the agenda, is a bit unpredictable, but we may hear about it on Monday, coming Monday. But what we know is, unfortunately, what Paola just mentioned earlier, right? That the progress report that we have submitted outlines that none of the targets are on the right track to be achieved by 2025. And one could say, and so what, that's an action plan that was written and is a piece of paper. But what matters most is that not achieving those targets means that a lot of people living with dementia continue to lack access to the care that is needed and that they deserve. And that includes, as it was just mentioned, diagnostic and post-diagnostic services. It also means that their carers do not get the support that they need in order to provide the care that they should and that they could if the support was there. And also that the research outputs are very low and they could help to tackle, deal with these challenges much better if resources were there. So in a way, the development and the implementation and financing of this action plan is a cornerstone to support people living with dementia, carers and families. And this was just highlighted. We saw the picture at the G7 meeting last week in Nagasaki. So similarly, effective strengthening and integration of person-centered health and social care systems within the broader context of achieving universal health coverage precisely, and the realization of the 2030 agenda for the SDGs is imperative in order to best respond to the needs of people with dementia, their carers and families. And there are three areas that are fundamental elements of this. The first is that we need a strong continued political will, effective resource allocation, and close collaboration amongst multi-sectoral actors, including member states, of course, but also international development and UN agencies, civil society, academia, private sector, and most importantly, people living with dementia and their carers in each one of the steps, as we were just reminded by Birgitta. Aging populations worldwide imply that the impact and cost of dementia will only continue to grow. Left unchecked, this will have substantial repercussions on our capacity as a global community to achieve sustainable social and economic development. While no country is exempt from changing demographic trends, too few countries are prioritizing dementia on national health and fiscal agendas alike. And in adding to what Paola was saying, the countries that commit to a plan, a national plan, in a way are committing to move some of those items forward, even if not all at once, right? Not having that commitment left the whole field a bit uncertain of what is that could happen or could not. In conclusion, I would like to emphasize that a challenge of the magnitude of dementia cannot be tackled by working alone or in silos. And it's imperative that we do continue to combine forces to learn from one another and to build positive efforts and learn again on how we can go farther if going together on this common goal. So really, thank you, Paola, for this opportunity, ADI, and looking forward for what's next.
Thank you so much, Dévora. Such an important testimony, and it's so important to remind everybody that we and the department of Dévora work very closely together here in the room with us at Tarundua, Rodrigo Cataldi, Stephanie Fields, and Catherine Siha, who have been amazing together with Nidja Chaudhry, who cannot be with us tonight, in following this from day one, and we work really, really closely to make this happen. So it's been fantastic to have you guys always on our side. So thank you so much. Now we're a little bit late, but we will rush through. So Alex, just 5 minutes. Can I introduce you to Alex Gobey, who is going to speak from the Ministry of Healthy Age, Active Aging in Malta. You may recall that we had the minister last year, and this is something that Malta does quite uniquely, to have a Ministry of Active Aging. This is a really positive way of looking at it. We love the idea of having a ministry on that. So Alex, the floor is yours.
Thank you, Paola. Thank you. It's an honor to be here today on this panel of experts, and I'm here to give an update on the progress that Malta is doing in our first dementia strategy. It's our last year of the strategy, and we early estimates are showing that we have completed approximately 80% of the recommendations in the strategy. There are a number of initiatives that we're doing which will be accomplished this year, such as increasing the number of anti-dementia drugs on the government formulary list. And this would, especially for people in the moderate and advanced stages of the condition. This, without a doubt, would help thousands of people with dementia in Malta, and it will remove some of that financial burden. We're also working on a number of dementia-friendly initiatives. Currently, we're working with the first responders, such as our community police and the civil department. And we're training them on what dementia is, how to communicate with someone with dementia, so that when they're called on scenes involving these people, they'll give a better service. We're working with local councils as well, our forms of local governments, where we're reaching agreements with them, once again, to teach the communities on the condition and where to get help and get services, including the staff working in the local councils. Also, we are working with the NGO in Malta, the Malta Dementia Society, the main NGO, and they will be setting up therapy sessions in our long-term care facilities and our dementia activity centers to carry out dance sessions and multisensory sessions, and also caregiver support groups. So we're very much looking forward towards this initiative. And a very recent development a week ago was the introduction of the Dementia Care Directorate, which will be tasked in providing leadership in the implementation of the current strategy and future strategies. And obviously will be working towards getting an interconnected approach, like we were saying. So we work with all the stakeholders, including the NGOs, private sector, people with dementia, and their families as well. We strongly believe in collaboration. In fact, one of the lessons we learned throughout this process was that collaboration is key, it's essential in order for projects and services to be effective and doing their work. And we also get feedback a lot from our end users to improve on certain services. So this directorate, I think, has been a very good initiative from the Ministry of Active Aging. And I'd like to thank Honorable Minister Joetienne Abela and Permanent Secretary Kristine Galstyan on believing in our sector and this area. Obviously, not everything is, this easy, and we have a number of challenges. One of the biggest challenges is that finding the right people with the right skills for the right jobs, seeking HR which are competent in the area. I think we have to think creatively on how and ways on attracting students and professionals to this field. Every strategy is based at the end of the day on professionals and human resources. And there are other challenges as well. Human resources is one of them, but we also have the challenge of creating. The challenge is that we join ADI, and I'd like to say maybe a phrase that ADI usually use, the time to act is now. And I'd like to encourage countries who are working towards their plans to take up this challenge that ADI is proposing. And we truly believe that this strategy is the most important step towards improving the lives of people with dementia. Thank you.
Thank you so much, Alex. I am delighted, and also the way that you're doing it collaboratively is so important. You've done it throughout, and you're really changing lives. And I know that things are happening. It's difficult, but things are happening. So that is really heartening to hear. Now we need to move quickly. So I am delighted to welcome Dr. Saidatul Norbaya from the Ministry of Health Malaysia. There is a picture here of Luis and I meeting the new Minister of Health just in January here at the Assembly for the Executive Board. So it's a joy to have you here with us, telling us something about the plan in Malaysia. Thank you very much. The floor is yours.
Thank you, Paola. Thank you for inviting Malaysia to share our first steps. Yep. Basically, talk about Malaysia's situation. The first, in 2018, the Malaysian National Health Mobility Survey estimated 8.6% of probable dementia in Malaysia, which actually the figure is far much higher than what WHO estimated at 5 to 8%. So looking at this, so what we moved, so we have we started to work on a dementia plan of action for 2023 to 2030, to ensure that people with dementia has access to affordable, comprehensive, sustainable dementia care, rehabilitation, and support services to allow a person with dementia and their caregivers to live with dignity and respect. This is our aim. Yeah. And the plan of action outlines 5 broad strategies, which involve multi-sectoral whole government strategies addressing prevention and risk reduction, early diagnosis, comprehensive management of dementia. And central to all of this strategy recognizes the importance of engaging people with dementia and their caregivers. Malaysia committed to improve in the prevention and care of people with dementia and their caregivers through several strategies. So several activities that we have done. Basically, in Malaysia, we have a dementia care services being provided via geriatric memory clinic in 15 hospitals, 21 cluster and outreach hospital, and 10 university hospital. We have actually offered evidence-based recommendation on the management of dementia through clinical practice guideline. And for example, the 2021 edition includes risk reduction techniques and managing special population. And since 2016, Ministry of Health has collaborated with Alzheimer Disease Foundation Malaysia, ADFN and ADI. Through one, we do provide training, courses for caregivers, and to date, around 1,000 caregivers were trained through this collaboration. We also celebrate dementia awareness campaign every year since 2008 in conjunction with World Alzheimer's Day. This is to increase public awareness and reduce stigma regarding around dementia, and to advocate policymakers that dementia is a growing public issue which need to be handled through government, whole government approach and society approaches. Third, we support the NGOs and private sector initiative in providing safe platform for communities to create awareness on dementia and their dementia family community. For example, Malaysia has established a project called Atria ADFM Community Corner, which actually sits in a mall where the mall the shopping center provide a space while the NGO run the activity for dementia and their caregivers. Through this space also awareness is given to public who come to the mall. In 2018, basically Malaysia has approved the Private Aged Healthcare Facility and Service Act that's supposed to oversee standard and quality of care for persons with dementia, especially those living in long-term care institutions. And last but not least, our problem basically is lack of awareness, stigmatization, and insufficient human resource remain as a key barrier for treatment and care for dementia patients. So we hope that the dementia action plan that is still under review will address all these issues and barriers to ensure the care for people with dementia. Thank you.
Thank you so much. This is such a great thing to hear. And we've been working so hard with Malaysia to make all this happen. And we know we're almost there. So I'm sure that you're going to join me in wishing everybody good luck and for this plan to come out very, very soon. You're doing fantastic thing. I've been to the Atria Mall, which is a great example how things can be done to increase awareness. So thank you. Now we're going to move here to a completely different type of country. We're talking now to the Netherlands, to Astrid Dunselman, who is here to represent the Ministry of Health in the Netherlands. Now, the Netherlands have been leading on dementia care in particular for many years. So Astrid, the floor is yours.
Thank you. Thank you, and it's great to be here. We tend to focus on pandemics and politics these days, but there are so many more topics and challenges to discuss and overcome. So Alzheimer's and dementia is definitely a very important one still for the Netherlands, and we share ADI's concerns on the slow progress in public health response to dementia, and we agree that more action is needed. So we all have our experience, I think, with this disease in some shape or form. My great aunt had dementia when I was growing up, but also I had the privilege actually to be working as a nurse intern at a hospital as a part of my first year training, medical training. And on our ward, we had an Alzheimer's patient. And so I experienced firsthand how challenging it is for a medical team to take care of these patients in such a busy protocol steered environment. And sticking a note to his back saying, please return to Ward 37 is just not cutting it. It's not satisfactory for anybody, not for nurses, not for his family, and definitely also not for the patient and his safety. And this was right around the time, actually, that our government established the first dementia plan in 2002. And so let me briefly walk you through our journey as the Netherlands in our policy development on this topic. And so the first plan in 2002, we focused on dementia care practice. And then second, as a development on that first care focused experience, I think I'm losing the mic. Try it. Is it? Maybe. Can you still hear me? No. We try a third one. No. This one? Try that one.
Hello? No, it's the same. I think we're losing a bit of audio. It's okay on
You
Zoom.
can,
Okay,
you can hear me.
continue. Yeah,
All right,
that's
so
fine.
I'll just continue. So I was at the first plan for dementia on dementia care practice in 2002. So after we established the financing, we focused on establishing and financing regional dementia care networks, multi-domain cooperation, and provision of case management. And we set the first steps towards a research program. So the third plan then was a national delta plan. And although, well, you probably know that the Netherlands is below sea level. So our first delta plan in the 50s was a waterworks program. So delta plan really stands in the Netherlands. It stands for a comprehensive. You need the microphone. Okay. It's actually working. Is it back? Okay, great. So I hope that works. So the third plan was a national delta plan. And as I just was saying, so a delta plan in the Netherlands really stands for a comprehensive, multifaceted plan that is a long-term investment for our safety when it comes to living below sea level and waterworks, but in this case, a national delta plan for dementia, focusing on support and care and on research. So then we come to the fourth plan that we are now at. It's a national dementia strategy that runs for 10 years, 2021 to 2030. And it has the mission that persons with dementia and their loved ones can continue and function as valuable members of society and receive appropriate support and care. And it is also comprising of sufficient and scientific research that is carried out into the possibilities of preventing, treating, and curing dementia. So we're focusing on three main themes: a world without dementia, so ultimately finding a cure. People with dementia matter, actually. So really focusing on social participation and meaningful activities, and support and care for those who are living with dementia. So, of course, our involvement in this topic does not stop at our national borders, and we are continuing to support WHO in progressing the Global Action Plan, but we're also sharing our knowledge and experiences on all aspects of dementia with other countries. And we are hopefully going to boost global attention for dementia in The Hague this year on the 2nd of October, when we will be hosting a high-level dementia conference called Defeating Dementia. And there we hope to generate renewed interest in the challenges dementia poses for society and the urgency of this issue. And we highlight the swift progress that could be made in care delivery and drug discovery. So we really hope that we can get to concrete actions on this conference to improve care and increase global governmental investment in dementia research. Thank you.
Thank you very much, Astrid. We are looking forward to the Netherlands governments to lead once again some of the European leaders into this particular area, also with your great health minister. Now, I need to move on really quickly because I know that there are a number of interventions that people want to do from the floor. So do we have Kristine Galstyan? No, we don't.
Yes, you have.
Okay, so I'm going to then ask Thomas to not do the final intervention, but the one before last. And in particular, Thomas, you will have reflected on some of the things that people have talked about here, from Birgitta, that really obviously is in a situation to want new therapeutics, to the fact that new therapies are actually on the horizon. We haven't talked about the elephant in the room here. This is the elephant in the room. What is going to happen to healthcare systems that are not prepared as well? Big question.
A complex question, as you would expect from it. I think first the good news is really when we met in the past, and I had the honor to speak to your 34th conference, which took place virtually. I also recall a meeting here. Basically, the information was grim. I recall in the early 90s, I was a member of the Swiss Federal Reimbursement Advisory Committee when we talked about reimbursement of symptomatic treatments. And they were truly symptomatic. And even then it was challenging. And there hasn't been much until most recently. I think what's positive is that dementia and Alzheimer's disease and the many forms of dementia was such a huge challenge for our healthcare systems and for our aging societies that it's really good to see that many scientists are hanging in, have been hanging in, despite the setbacks, despite the disappointments, despite the complexity of understanding, how our brain works. I'm on the biocampus sitting next to the Blue Brain project. And if I recall rightly, I think the ambition was to recreate the brain with a computer model. I don't think that they've already finished. And we saw, in the challenge to come up with, you talked about defeating, treating Alzheimer. I think something which we have to admit, we need to be humble and we need to be models. Therefore, moving from symptomatic in late stage to actually disease modifying treatments. And I'm deeply sensitive disease modifying. It's not, such a game changer yet. And therefore we shouldn't overstate the progress we made. And it's also complex in terms of the side effects it can have. That I'm deeply conscious. And as Paola, I'm of an age where I'm concerned about, dementia, and I'm really interested. Therefore, I think it is positive that we have two companies, Eisai with a accelerated approval by the FDA in the US, and Lilly announcing that they are ready to file, and both of them going through a routine drug approval system, which means the proper system. I think that is extremely positive. This will pose challenges. And we saw in your, let's say, pretty grim overview of how many countries do have national action plans, how many countries are there, honest responses, far too few. Whenever I go to Japan, and I love Japan, this is one of the few countries who talks about aging, something positive for the country. I don't know, notwithstanding the movie, which came out recently, I have no intention to just pass away when I will turn 75. I do intend, to enjoy actually, and the Japanese, I think it was late Prime Minister Abe, who really coined the phrase of actually aging as something positive for society. And the more we make out of it, I think the more we can learn. I must say I was impressed by listening to Birgitta, because one of our fears is you have this diagnosis of cancer or dementia, and that's basically the end of the life. And what really moved me listening to Birgitta is that diagnosis is actually something which can help you. And I think what's also important is our systems need to be made for support. We know more now about, and I think you in the Netherlands have done quite a bit of work on, for example, risk prevention. You have in your report, when I go to Delhi or when I was in Indonesia, oh my God, pollution is really, health hazard, a huge one. We know about, of course, the importance of, for example, nutrition. I was jogging along the walk the talk last Sunday, actually leaving my team far behind, and they're about 30, 40 years younger than I am. Therefore, we know that actually there are things which you can do, but we also know that there are genetic predispositions, and we really need to make sure that our systems are there. But also from an industry point of view, there are two challenges. One is we can't be satisfied with now having two potentially, really disease modifying and something which makes a change. We need to hang in on research, and actually success there hopefully motivates other companies to invest in Alzheimer's disease, because for 30 years, Alzheimer's disease was basically predictable failure, and you have to write off the investments you made. Therefore, I think it's so important that the companies hang in. But the second issue, which is equally challenging, and moving with the disease burden from the rich countries, and it's challenging the rich countries. Let's not, kid ourselves, to find ways how can we make sure that these new drugs, these disease-modifying drugs, and hopefully one day disease-treating or preventing drugs reach patients. That will be a challenge for the companies, because it's not of much use if you have something which has been approved and it's too expensive, it's not affordable, it doesn't reach the patients. Therefore, this will be a challenge for health technology assessment, for pricing, but it also is a challenge for the companies to get it right, but equally a challenge for the countries to walk the talk that they do care about making progress in Alzheimer's. With that, I think much more reason for hope, but there's a lot more to do, and we need to join forces together. That's why I can never resist when Paola invites me to come, because what you do is so important.
Thank you very much, Thomas Cueni, the Director General of the IFPMA. These are big issues, and Thomas has raised some of the big issues around risk reduction factors as well that we will be tackling in the World Alzheimer's Report in September. Now, I can see there's quite a lot of people that want to intervene from the floor, but before then, we have gotten a connection with Kristine Galstyan, the Chief Organizer of Public Health Department in Armenia. Kristine, you have less than 5 minutes, I'm afraid, because we do need to take some interventions from the floor. So I'll ask you to run us through it, and thank you for being with us this afternoon. The floor is yours.
Hi, yes, hi everyone. I'm pleased to be part of today's meeting and have a chance to introduce my country's practice. Armenia is a small country with almost 3 million population, and our pace to success is also small. Today, I would like to share with you one of our success stories, which is a development of National Dementia Plan. Why I consider it a small success? Because the big success will come after implementation of it. My practice will be beneficial to those countries who are about to start development of their national plans. So we start our plan development from development of National Dementia Plan framework, and just after that we start with our stakeholder mapping. We identified different multi-level stakeholders and continue with the engagement of them. They were from different ministries, from different specialty health providers, NGOs, local NGOs, and also non-formal caregivers and patients with dementia. We proceed with qualitative research. We organize different focus group discussions with them and come up with analysis and identified all the gaps and needs existing in the country. Then we followed, we stay compliant to the WHO Guide Global Action Plan on the Public Health Response to Dementia and adapt this guide to our country context. As was described in the guide, we also chose 7 priority areas for our dementia plan. And based on our qualitative research analysis, for every action area, we identified problems and defined the strategic directions which might solve the existing problems. I do not want to go into the details, but I would like to talk about possible challenges we might meet during implementation phase and discuss some areas where support in dementia may be needed on more expert level. So for us, it is very important to develop a collaboration plan among multiple stakeholders. Also for Armenia, it is very important to develop a good plan for increasing visibility of the issue, as now in Armenia, people do not recognize the issue and they usually refer all the symptoms to normal aging processes. So starting from 2022, we launched public health campaigns for changing aging stereotypes in our society, and this year we will do more interventions for improving situation with changing model. Yes, and also maybe we will have challenges with defining the with implementing the information system for dementia, the data collection system, the analysis and utilization of the data, and also development of multi-level service provision system and referral system. This is the areas where we would most probably need your expert opinion and support. And I would like to express my great thankfulness to Jane Mahakyan. She's who represents Alzheimer Care Armenia and all her team, as they were guiding us through all the process and motivating us and being always with us. This is one of the steps towards our success. You should also have such friends next to you. Thank you.
Thank you so much, Kristine, and thank you for condensing a whole massive amount of work. Armenia is one of our success countries this year, with Uruguay, one of the countries that has managed to get a plan, and as you heard from Kristine, quite an organized one at that. Now, I've got to move us swiftly on. We have Mr. Kosuke Wada on the line from the Ministry of Health, Japan, and I would like to ask Kosuke if he could come online from Japan and telling us some advances in the Japanese government progression. I'm not entirely sure we can hear you.
Hi, good evening, everyone. Midnight from Japan. Could you hear me?
Yes.
Hi.
Yes.
Thank you. We Japanese, I'm a Dementia counselor for National Action Plan, in charge of the Japanese National Action Plan. We Japanese government have a plan for 2025, and we hosted the G7 symposium, Dementia Symposium, just last week, inviting Paola and Dévora. Thank you very much for your compilation. Please see the G7 Health Ministers communique concluded in Nagasaki, and they say the importance of integrated approach for dementia action plan in line with WHO's National Action Plan. Also, they focus the importance of innovation and inclusion. The total package of early detection and intervention and early diagnosis is very important for the new era in the dementia. Thank you very much. And we are very happy to work with all of you and the global leader. Thank you very much for the short comment.
Thank you very much for doing this intervention, short and sweet. And obviously you've been the leader for years about this. So thank you also for your massive amount of work, you and the team at the Ministry of Health Japan. Now we have the pleasure and the honor to have the Deputy Minister of Health in El Salvador, Dr. Carlos. I don't know if you want to make an intervention from the floor, or somebody else from El Salvador would like to make an intervention from the floor. Would anybody like to say something about the fact that you're thinking of doing your dementia plan? You can speak in Spanish because we have an IE translation.
My name is Carlos Alvarenga, Vice Minister for Health from El Salvador. Hasta aquí mi inglés. Quizás el tema de la salud mental es vital para un sistema de salud. Hoy con la pandemia nos hemos dado cuenta de lo vital que es las estrategias de salud mental, que ha generado muchas condiciones de deterioro precisamente. Los sistemas de salud han sido afectados en términos generales, pero es una oportunidad para los sistemas de salud de hacer una reingeniería, precisamente porque la salud muchas veces en muchos de nuestros países. ¿Hay translate?
Shall I?
No, we should be having an automated. Yeah, for the room. Yes, please. Yeah.
For all?
No, briefly. Doctor, yo le hago una traducción muy breve de lo que dijo. The Deputy Minister is talking about the impact of COVID and mental health and how there is a need of a comprehensive approach to these issues.
¿Quién empezó hoy?
Yo no soy una traductora, así
Muchas
que no se
gracias.
espere mucho.
Pero ya veo que es multifusión. No, muchas gracias. Hay un aspecto importante en los sistemas de salud. Hoy la pandemia nos ha demostrado que ha una sensibilidad hacia el tema de salud.
The pandemic has demonstrated a certain sensibility or attention to the health system in the country.
Y los sistemas de salud tienen que aprovechar esa sensibilidad, porque como la pandemia afectó a todos los sectores, desde las personas con muchos recursos económicos y otras que no lo tenían, sectores social, cultural, político, económico, hay una sensibilidad hacia el tema de salud.
The impact of the pandemic in different sectors, economic, political, etc., has created this sensitivity towards health. And so the health system has to take advantage of that interest or attention.
En ese caso, los sistemas, de alguna manera, los sistemas de salud tienen que aprovechar. Este es el momento de los sistemas de salud para aprovechar y trabajar las diferentes enfermedades y hacer una reingeniería en los sistemas de salud.
So rethink the health system based on this current interest.
Todas estas afecciones, el tema de salud mental ocupa un elemento importante por la misma afectación de la pandemia.
And mental health has a specific role precisely because of the pandemic as well.
Y de entre estos, el deterioro de las personas mayores de edad es importantísimo y tenemos que cuidar.
Within this sector, the aging population is very important and we need to take care of it.
Lo último, hay que aprovechar. Este es el momento de los sistemas y hay que aprovechar y cuidar a nuestra gente bajo una visión holística. Y me termino con esto.
But this is the time to then create a system that will provide a comprehensive answer to the current needs.
Thank you.
What can I say? What a great intervention and what a great translation as well. Kind of simultaneous. Thank you very much, Dévora. Thank you very much, Dr. Carlos. It's really, we are leaving you with a high note. Now, I have a lot of questions, and I actually had a request for more intervention from the floor, but I'm afraid our time is over, so I'll have to wrap it up. But there is one question in the Q&A which is really important. Somebody asked, why are the plans being dragged, and what can we do as citizens to change this with our governments? Well, this is a question I really like. We can all do something to change this. And this is why today we are here to you talking also about our What's Your Plan campaign. When we will ask you as citizens in your countries to interact with media, to interact with your governments by interacting with our campaigns, please do so. Governments do listen, because once you get 1,000, 2,000, 10,000, 20,000 people starting writing to governments, things do change. So I'm afraid when we have really feet being dragged, that is the only way to move the discourse forward. Mind you, we are also very lucky because there are a lot of governments which are being fantastic, leading the way, and I've got some of those examples with me today. So there's a lot of positive things happening, but when we will ask you, please join us. And join us also if it's not your country, if it's another country. Numbers matter, they count. 55 million people living with dementia these days, countless more families being affected by it. It's the 7th leading cause of death. So let's remember there is a lot of us. We can make our voice heard. Thank you very much for following us. Thank you to the team here and to the participants. It's been a pleasure to have you with us. Thank you.